All right, next we're going to talk about managing the symptoms and the side effects of treatment. So a big part of nursing in cancer care is managing the symptoms of the cancer, but also the side effects, because the treatments for cancer are very, very intense. Okay, they're trying to kill cancer cells. There's a lot of collateral damage in other tissues. Okay, so first of all, pain. Opioids should be administered around the clock rather than PRN, and they should be titrated to pain and breathing. Non-pharmacologic strategies can help with the pain, but they are not a substitute for adequate pain meds. Cancer can be quite painful, and patients with cancer need adequate pain management. Myelo suppression. There are some diseases that suppress bone marrow, but also chemotherapy and radiation suppress bone marrow. So what are the risks if we're suppressing bone marrow? Okay, myelo suppression is suppressing bone marrow. Infection because of no good white cells. Okay, so how do we prevent infection? Private room, no visitors who have infections, hand washing, no live virus vaccines, assess for the risk and symptoms of infection, and have a really high index of suspicion. Protective isolation may be needed, and they have to meet an adequate white blood cell count guideline to return to school or to return to being out in public. Good nutrition. Okay. Anemia. We don't make red blood cells. We're anemic. They may need transfusions. Other than that, we manage that with rest and if they're hypoxic, oxygen. For bleeding, no platelets means bleeding. We avoid punctures. We want to give careful mouth care because they can have mouth ulcers and bleeding gums. Careful perineal care. They can develop ulcers around in the perineal and perianal area. Lots of skin breakdown and it can bleed, so really careful perineal care. We want to help that patient avoid injuries that may cause injury or bleeding. If they have active bleeding that's not responding to other measures, they may get a platelet transfusion. Okay, so we've done pain, myelosuppression. Anorexia is also sometimes a symptom of the cancer and often a side effect of the treatments. So we want to offer frequent small amounts of nutrient and calorie dense foods. Every bite they eat, we want to make it count. We want to assess for stress and other factors that may make it harder for them to eat. If they cannot take in enough food, they may get tube feedings or TPN. Stomatitis is sores in the mouth. Those sores can actually be throughout the entire GI tract and in the perianal area. But for stomatitis, the ones in the mouth, bland, soft, moist diet, a soft sponge toothbrush for oral care, frequent normal saline or sodium bicarb mouthwashes can help. There are local anesthetics that can help, and sometimes they'll make a mouthwash or a mouth rinse of a local anesthetic, diphenhydramine and Maalox. We want to avoid things that dry, so we want to avoid lemon glycerin, hydrogen peroxide, and milk of magnesia. If they're not able to eat because of the sores, they may be hospitalized for hydration or nutrition. If that patient is in braces and they're not able to tolerate oral hygiene, the braces may need to be removed. For rectal ulcers, we want to make sure and keep them clean. Sitz baths can help with comfort. Use occlusive ointments or dressing and keep their stools soft. For neuropathy, the neuropathy caused by chemo can cause constipation because the bowel is not innervated well. So we want to make sure that they're able to go. They may have diarrhea, but if they're having constipation, stool softeners or laxatives can help. For the neuropathy, we also want to maintain their joints in good alignment, prevent foot drop and joint injuries or contractures because they don't have the sensation to move and keep their limbs in good alignment. Also fall risk. Remember, neuropathy is a major fall risk. Soft or liquid diet if they're having jaw pain. For hemorrhagic cystitis, that's when the bladder lining is inflamed and bleeding. Lots of fluids is helpful. Frequent voiding is helpful. The medication that causes this needs to be administered early in the day so they can flush it out and it's not sitting in the bladder overnight. And there are some meds that can protect the bladder, so protective agents. Alopecia, lots of preparation and support, soft cotton caps, protect the scalp. They can lose heat through the scalp, and also they can get the scalp sunburned. So teach them to protect the scalp. Hair tends to regrow in 3 to 6 months, but it may change and it may be different in color and texture. Steroids can cause moon face and other side effects, so we can help them prepare for that. Steroids can also cause mood changes, so it can help them prepare for that. And it can complicate their emotional response. They already have a situation that's a lot to take in, and now we give them this med that affects their emotional responses. So that's very common. Okay. We're going to talk in the next section. I do want to talk about nausea and vomiting, which I'm not sure why it's not here. For nausea, vomiting, we want to give them the foods that are easily tolerated. We don't want to have strong smelling foods in the room. Give small, frequent meals. Some of the things we do for anorexia. Ondansetron is often given for chemo-related nausea, and it should be started either before or with the chemo, not after they begin vomiting. All right, now, next section is going to be about administering chemo meds.